Accent can significantly influence the quality of healthcare that you receive. A lot of people get healthcare through telemedicine, and that even worsens the situation because the absence of face to face interactions and non-verbal cues, all you have to rely on is your speech. Accents can also contribute to certain biases when it comes to making clinical decisions. Accents can lead to a lot of communication barriers between healthcare providers and patients. Let me give you an example. If your healthcare provider, say a doctor or your dentist or whoever you're seeing, has an accent that is unfamiliar to you as a patient, it might lead to you misunderstanding the way they explain the medical advice that they're giving you and the treatment plan that they may have built for you. And this is especially critical when discussing very complex medical problems. Vice versa, if as a patient you have an accent that is unfamiliar to your provider or your doctor, it becomes really hard for you to explain your symptoms or your concerns. This can lead to a misdiagnosis or even a delay in treatment. Also, accents can trigger unconscious biases. For example, a patient or healthcare provider presents in an accent that is considered prestigious or exotic or fancy, there is a tendency for more trust to be developed with that type of a relationship based off of that attribute alone. And again, vice versa. So if you're considered having a very strange and maybe not very popular accent, less competent. So imagine being judged on your trustworthiness or competency levels simply based off of the accent that you may have. This can impact the relationship that you would have with your patient or with your provider, and it trickles down into impacting the quality of care that you may give or receive. So how to fix this? From a patient's perspective, if you go into a healthcare setting where you feel like you're not being understood because of attributes that you can clearly identify, such as your accent, it is your right to request a translator or an interpreter. The relationship that you have and you build with your healthcare providers is super important for you to safeguard and not let things such as accents come in between the way of you getting the highest quality of care possible.